Hello guys, welcome to the second part of the DNB Osce Anesthesia July 2023 session. Today we will be discussing the question number 6 to 10th of this session, and in the third part we will be discussing the further question. So this also, sixth question is also image based question. Identify the block and point A, B, C denotes what. Okay, so they have given ultrasound image which showing the anterior and middle scalene muscles together with they have pointed the mark as A, B and C. So this what is identified the block is nothing but your interscalene brachial plexus block with A point towards upper trunk of brachial plexus, B to the middle trunk of the brachial plexus and C towards the lower trunk of the brachial plexus. These are the 3 points they want to identify, and what type block, which block. First question is which block we identify, this interscalene block. Coming to the second question is most common complication of the block. So most common complication considered to be ipsilateral, that is hemiparesis of the ipsilateral diaphragm. Why? Because of the ipsilateral phrenic nerve blockage. It can resulting in ipsilateral diaphragm weakness. Hemiparesis or diaphragm weakness, which may resulting in respiratory insufficiency in the patients. So this is the most common complication associated with interscalene block. Okay, what are the 4 contraindications of this block? So 4 contraindication is common blocks. What are the contraindication? There may be local site infection if anything is there, or patient having coagulopathy, because there is increased chances of any hematoma can occur, and specifically in this block if the patient having some respiratory insufficiency beforehand, disorders like restrictive lung diseases like myasthenia or GBS, neuromuscular weakness if the patient is already having, or the patient is having associated features like vocal cord palsy if the patient is already having vocal cord palsy. If the patient have vocal cord palsy and if you give the block, and it will, if it block the recurrent laryngeal, if it is blocked, it can result in the patient having stridor. So you should take care of the patient who have vocal cord palsy in the pre and before itself we are giving the block. Okay, these are the 4 contraindications of the block. Okay, this is the sixth question of the interscalene block. Coming to the 7th question, there was history given, that is 47-year-old man with kyphoscoliosis came with the features of breathlessness like that admitted, and they are shown the image of the spirometry, identify the term of lung diseases in spirometry. They have shown the restrictive pattern of spirometry. So restrictive lung disease pattern of spirometry due to kyphoscoliosis. Okay, the spirometry has been shown image. Next question is asked to mention the 4 conditions causing the type of this lung disease. So mostly they are asking about restrictive causes. So restrictive causes will be pleura related, pneumothorax, effusion or something. This is pleural related. Other chest wall related, there may be patient having morbid obesity, or the patient having neuromuscular weakness like myasthenia, GBS, Guillain-Barré syndrome, or a patient having scleroderma. So these are some of the conditions that can cause restrictive type of lung diseases. So you have to mention any 4 of these conditions. What are the methods used to measure the angle of kyphoscoliosis? Is by Lipman-Kopp method. Lipman-Kopp's method, that is Kopp's angle, your most favorite question. Kopp's angle, how will you measure it? Is by Lipman-Kopp's method. Other is Weber-Ferguson method. Sorry, Reiser-Ferguson method. These are the 2 methods which can use to measure the angle. They specifically asked 2 methods is to measure the angle, kyphoscoliosis angle. So what happened to FEV1, FVC-FEV1 ratio in this patient, they have asked. So patient already having kyphoscoliosis, so restricted type of lung diseases. So both FEV1 and FVC decrease in the restricted type of lung disease patient. When both decreases, then FeV1 by FVC will be becoming normal in this kind of restrictive lung disease patients. So these is the this are 4 questions regarding to the kyphoscoliosis. Coming to the next third question, what they asked is nothing but identify the curve. What is the curve? Identify the curve. So they have just mentioned 20, 40, 60, and it is a sigmoid shaped curve with 20, 40. So it denotes PO2 in the x-axis and percentage of oxygen saturation in the y-axis. So this is an oxygen dissociation curve. Okay. Even if you have any doubt regarding the curve, just see the next questions, you will be able to identify the curve. Okay. Point A, B, C denotes what? So B, everyone able to identify, that is P50, where 50% of the hemoglobin is saturated with O2 at 27 millimeters of mercury. What is the point C is considered to be PA, that is at the level where 80% of the hemoglobin is saturated with the oxygen. After that, however, how much oxygen you will put back, the hemoglobin is fully saturated here. This is fully saturated part of the hemoglobin. After that, how much oxygen if you give, then it won't increase the curve, it will become plateau, it will plateau after this. So this is the point where they have asked about that actually. Next question is shifted to the right. The curve is shifted to the right. What are the conditions? So shift to the right means what will happen to the oxygen delivery. They have asked the question. So oxygen delivery will get increase. How come oxygen delivery will increase? There is decreased affinity of the oxygen to the hemoglobin. Why there is decreased affinity? Because of the increased 2,3 BPG, the affinity of hemoglobin with the oxygen decreases, so that there is increased oxygen delivery to the tissues. So this is because of this shift to the right causes increased oxygen delivery to the tissues because of decreased affinity of hemoglobin because of the increased 2,3 BPG. This is the main reason. Next, the fourth causes will be 4 causes shift to the right. That already you have known one cause increased to 3 BPG. Other things will be there will be decreased pH. The patient may be having acidosis because of the increased PCO2, and the patients may be having increased, what are other things? Mostly everything is increased temperature. So just they were asked about 4 causes. Just mention the 4 causes. That's fine. Okay. Next question, why O2 dissociation curve is sigmoid in shape? This is sigmoid in shape because of the cooperative binding of oxygen with hemoglobin. So what is cooperative binding of oxygen with the hemoglobin? When one molecule of oxygen bind with the hemoglobin, it increases the affinity of the further molecules to bind with oxygen. So this increased affinity of this binding of the first molecule of oxygen increases further binding of other molecules of the hemoglobin with the oxygen is known as cooperative binding. Because of this cooperative binding, this oxygen dissociation curve is sigmoid in shape. Okay, so coming to the next 9th question is identify the image. This also they have given the history of 24-year-old female patient with having the history of recurrent syncope in the past and now presents to the emergency with palpitations like that. A heart rate was around 160 or something. They have mentioned heart rate of around 160 per minute, and BP is around 90 by 60 millimeters of mercury. History was given and identify the ECG. They have shown regular narrow complex tachycardia. So this is SVT, supraventricular tachycardia. So what is the management of the condition? Next question is asked. So coming to the management, you have to divide it into 2 parts. The patient is hemodynamically stable, what will you do? Hemodynamically non-stable, what will you do? That's unstable, non-stable or unstable. Stable means you will be giving adenosine. So sorry, before that you will be giving carotid massage. carotid massage, that is a temporary measures. It will settle on its own. If it's not settled, then you will be giving adenosine. First dose 6 mg followed by 12 mg adenosine rapid saline push you will be giving. If the patient is unstable, then go for synchronized cardioversion of 50 to 100 joules. You have to give shock cardioversion. That is to the, you have to correlate with the R wave of the ECG. You have to give the shock. If the patient came back unstable, what is the next management? Just a shock cardioversion. That is the answer for third question also. So more or less they ask the same in second and third question. Answers will be the same. Okay, coming to the next question, 10th question. This is in hospital cardiac arrest image has been given. You know that the recognition of the cardiac arrest and activation of the emergency response. You have to start CPR. This and we have to give defibrillation as early as possible. Post cardiac arrest care and recovery. These are 6 components of the image of the in cardiac arrest. They have asked about the 6th addition in the in hospital cardiac arrest, which is nothing but your recovery phase is added. That is the 6th link. Next question is, if ROC, such a return of spontaneous circulation, is achieved and no consciousness is regained, that means patient is in coma, what will it do next? So everyone will know that is a targeted temperature management, 32 to 36 degrees centigrade for 24 hours by rapid cooling devices you have to maintain. Next thing, obtain a CT of the patient, EEG, and other critical care management. We have to follow the other critical care managements. So main answer they want is targeted temperature management. That is the answer. That's why they asked the question. So next, third question is, they asked about what are the 5H and 5Ts of reversible causes. You know 5Ts, you know toxins, cardiac and pulmonary thrombosis, tension pneumothorax, and tamponade, cardiac tamponade. These are the 5Ts. 5H will be hypovolemia, acidosis. H plus ion increase will be there, no? So acidosis, H plus ion increase, hyperkalemia, and next most common thing of this is hypothermia. So hypothermia can also cause the results in this, and next is hypoxia. So these are the 5 things of 5H 5Ts of the reversible causes of the cardiac arrest. Okay, so mostly I have covered the 5th to 10th question of this part. If you have any doubt regarding this 10 questions, you can put a comment section. The comment section will just ask the doubt, so that I will update it in the forthcoming videos if you have any doubt regarding this. Okay, so keep supporting me. If you are new to my channel, please subscribe my channel so that it motivate me for doing more videos for you guys. Thank you guys.